I do work for a community-based organization that I will have no direct contact with the contracting or any of the payments that will come out of it. But way down the line, I would eventually work on that, do that scope of work. But I just wanted to let everyone know right off the bat that at this time I don't have a conflict of interest. It's not to that level yet. When it does, I will recuse myself.
Like Molly, I too may have a conflict of interest, but I don't have one right now, so I just want everyone to be aware of that with Care Connect funds.
Yep, same boat with Grant County Health District.
We all do good work.
And just clarifying for everyone, just make sure you're aware, they all work and they're part of organizations that would be care coordination agencies, so they would be potential agencies or our agencies that subcontract with Action Health Partners shop.
Any other questions, comments? Is there anything in the chat? Seeing as I can't read the chat that we need to know about?
Harleen is driving, so she's not, or in transit, so she's not able to turn on her video and may be in and out.
John, will you hit the OK button at the top?
All right. I will just take the moment to recognize there is an edit in the minutes. It should be vital conditions, not vital conditions. Since Peter put it in the chat and Rosalinda has already called it out prior to the minute, we will get that corrected.
Okay.
John, I think you just put that in there to make sure we read them, right?
Well, now I know.
I've got a question about the Healthcare Authority contract case 7653. My question is, John, do you feel, or does the board feel like that 8.2 and change million is reasonable? Or I just want to make sure that I don't know what other healthcare or other ACHs are getting, and is it population based?
So the let me pull that out quickly. So there's 3 components to it. So there's 2 different funding sources in that. One is health-related social needs infrastructure funds, and one is health-related social needs services. You'll see in the contract, there's 3 line items, one for basically 2023 to 2024, 2024 to 2025 health infrastructure funds, and then HRSN services is just for 1 year of that. I would say the infrastructure funding is what we've expected and been planning for, maybe slightly lower. There was a decrease to the service funding that was not originally expected. Really what it impacts is the size and capacity we can build in our care coordination infrastructure and our hub work. So we can still adjust our size based on the funding we have available and the amount of agencies we can work with. Do I think it's reasonable? I think it's gonna impact how much reach we can have. A number of the ACHs are looking at with the current funding source, and it's all based on population, that we may be able to gauge about 3 to 4% of the Medicaid population with that funding. And so it's not insignificant, but it also means that there's a lot of additional reach that could be done if the funding was larger. That said, our region is also working really hard to collaborate with programs like the Health Homes program, Recovery Navigator program, Recovery Coach program, so other care coordination programs that also serve the Medicaid population. FQHCs would be an example of conversations we need to continue to engage in so that we can basically expand that reach by doing a good job connecting, referring to different programs.
Thank you, John.
Okay. All right. If there's no further discussions or comments, I'd entertain a motion to approve the consent agenda with the correction to the minutes of vital conditions versus vial conditions.
I move that we approve the consent agenda.
Second the motion.
Yeah, it has been moved. Oh, go ahead. It has been moved and seconded. Is there any further discussion? Okay. All those in favor say aye.
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 Aye. Aye.
Opposed? Okay, motion carried.
And Wendy, do you want to share my slide deck or do you just want me to bring it up for the ED report?
I have it.
Okay, can you?
Real quick, John, I know we don't approve the agenda. However, I do believe there's a change in the agenda.
Thank you.
Okay. See, I am on my toes sometimes.
You're getting the hang of it.
I do. Peter caught vial and under board election, I believe we need to remove Detective Silva as a nomination, correct? Okay. All right. That is the only change into the agenda I am aware of.
Correct.
We're good to go. All right. Go ahead.
All right, Wendy is bringing up my PowerPoint. Wendy, I'll just say next slide when ready. So I'm gonna give today, when I'm ready, Wendy. Well, I'll jump, well, so today my ED report's gonna include a number of waiver updates, so just be ready for that. Wanting to get you guys up to speed on some of the re-entry work, and then we are planning really for the community hub, community-based care coordination work at this point in time, kind of alternating between meetings to give you more of a detailed report out every other meeting of the work that's going on, and then infuse things in the ED report as well, so that each month we're keeping you up to speed, but every other meeting we're ensuring that you guys are getting more details, especially since there's a lot going on with waiver. There's a lot going on our care coordination work, as you guys just approved 3 contracts associated with that. But before we jump into that, first off, I just wanted to give a shout out to our team. The summer really has been a busy few months for us, whether it's through the waiver contracting, whether it's through the CPTS conference, whether it's people being on vacation. We had a fun string of illnesses go through, not just me, but a number of people go through our team. Mariah had her baby boy Reese and is now on maternity leave. So we've just had a lot of personal, professional things going on, and the team has done a very good job of just sticking to it and working hard and putting the effort in where they can, and then trying to support each other when someone was sick. So I just want to give a shout out to everyone we've been in and out and that, and we're still, working as much as we can as a team. I think we're all ready for things to settle down, for us all to have a little bit more time in office together, for vacations to be over. But they've been amazing this summer for all the different things that have been going on. And then now you can go to the next slide. I also want to welcome Kyle DeSalto.
Desatel.
Desatel. Oh my God. Sorry, Kyle. I practiced this before. Thank you, board chair. Our tribal engagement and community empowerment manager, he is here with us today. Kyle, do you mind sharing a few words about yourself?
Sure. I'm a Caldwell tribal member, so I've worked with the tribe for pretty much all my life, but 15 years with the tribe and 5 years with the other various tribes. I'm trying to absorb everything today. I know there's giving me a lot of information, but I'm really excited to be on board.
This is his first day,
Yeah.
so.
Oh, wow. Yeah, like-
As Teresa has noted, we try to like start people on board meeting days, so that.
Did you start it?
No, but we started. No, I did not.
Kara.
I started alone in the office, but we started Kara.
I thought it was
board meeting
close.
days.
We've had a few start on board meetings. Me and Teresa recollected the days where like we showed up to start, no one was in the office for like a day or two.
I started alone. Nobody there. Reading materials.
So we're very, very good at getting people started, maybe not on the perfect day of the week. So we're glad to have Kyle aboard, getting him up to speed and getting him oriented. He's already been starting to have conversations with people in different tribal departments, so really looking forward to it. Just as another FYI for you all, we are still interviewing for the Director of Operations, and we have a few more interviews this week, and I will keep you guys informed as we go along. Next slide. Just a few quick organizational updates. This Friday, we're gonna have our second legislative committee. Emilio, Ray, thank you both for being on that committee. We've had our first meeting a month ago. Ray's giving us thumbs up. And we're really just starting to gel as a committee, starting to figure out how we engage the community in identifying some of our advocacy agenda items. And so we've talked about whether we run things through the CHI, whether we use our Vital Conditions Network as mechanisms to get input on really what Driving Together's policy agenda should be. We're going to be digging into that a little bit more at this next meeting on Friday. September 8th, mark your guys' calendars for the board retreat. It is going to be at the ESD building, correct?
Right.
9th, sorry. September 9th, and I even have it up there, in the ESD building over in Wenatchee. We are gonna be working on that agenda and we'll get out details in the next couple of weeks. Just things that keep a watch out for fall of 2024. We're getting into starting the plan for budget for next year, so our team is gonna start diving into and start budget planning, and so you guys will start seeing some of those numbers coming up, at least by the October board meeting. You'll have a draft budget. We've also been in conversations of expanding this conference room. We've had some conversations with Don, the owner of this building, to actually expand it out this way. There's a lot of empty space here. We've been utilizing the CTC still for a number of trainings that this space just isn't big enough for, and the CTC is a beautiful space. It's also not the cheapest space out there as a whole, so ran some numbers, we're getting some quotes on what it would cost to expand out here. And so we are looking at that as a viable option, so that then we can move any trainings in-house here. Next slide. I just want to give a shout out to Veronica and the CI team. They had a dialogue training about a week and a half ago on a Friday over in Quincy. And you can see all the individuals who participated in that training. I had a chance to attend as well and chat with individuals. And I got to hang out with the Grant County CHI folks, which was really great, just to get to know everyone a little bit more. We all had a chance to practice community dialogues, had a chance to understand how you hold community dialogues, and it was a great event. If you go to the next slide. I thought I had another slide in there. Oh, yeah. here's just a few additional pictures of individuals participating in the training. So we had a nice mix around the counties. Veronica is going to touch base on this a little bit more in her update, so I will kind of keep it at that and let Veronica speak more about it. Keep going to the next slide. Teresa stole my thunder on this one, but I wanted to just congratulate Advanced Northwest and Family Health Centers for a successful Community Partnership for Transition Solutions Summit. And Teresa Davis, Joseph Hunter, and Caroline Tellier for assisting in the planning efforts. I know Joey was sitting on the planning calls for a good couple of months, if not longer. And so he's been really actively involved in the planning process. And I know Teresa really put a lot of time in helping with logistics and planning as well. So especially both of you, a huge shout out and thank you for supporting this work. This is very much in alignment with the reentry work that the Healthcare Authority is doing. We had an opportunity to have Tyron Nixon and Emma Oppenheim join from the Healthcare Authority. Tyron was a presenter and a keynote speaker. So it just very much helped align some of the work that the Healthcare Authority is, but really what I see with CPTS is a lot of the grassroots efforts going on in transition. If you go to the next slide. Few people to call out, as you see on the screen, and it's too bad Dell isn't here unless he logged in. Dell Anderson got an award, the Using Your Voice Award, for being the voice of recovery and transition work in the region. And Joey Hunter got the Community Leadership Award. So I just want to give them both a huge shout out for all the work that they have done for our recovery community. Ray's clapping silently on you. But just amazing, it's amazing the work they've done. You know, really Renew has been a strong partner and growing partner in this work as well. And so really what Dell has done with that has been amazing. Next slide. And then as alluded, shout out to the Thriving Together staff who did presentations. So Joey moderated one around the evolution of the Recovery Coach Network that I was able to be a part of with some recovery coaches. We did one on thriving resilience and well-being. And so Joey and Sarah and I got to present. Veronica was going to be on the panel, but she was out sick that day, so she got to do all the prep work for it and the planning and the practicing, but she wasn't able to attend that day. But thank you all for being able to represent us at the conference. We really, I know it's Advanced and Family Health Centers event, but I was really proud of how much our team put into it. And again, like I said, it really aligns well with the reentry work that we are supporting across the state. We go to the next slide, which just gets me into a little bit of the Healthcare Authority reentry work. So after the summit, you see up here some of the goals of the reentry work. After the summit, so the Thursday after, Emma and Tyron were able to go up north to OMAC to meet with Advanced Family Health Centers, myself, and the Okanagan County Jail Chief, Stefan Wolak. And we met and we spent a number of hours talking about the reentry initiative with the state, what Okanagan County Jail is doing in partnership with Advance. What are some of the needs of rural carceral facilities in this work where they would be successful, where they're going to find challenges. I really want to give a call out because HCA has now had a chance to meet with Chelan Regional Justice Center, Grant County Jail, Okanagan County Jail. So all of our county jails have had an opportunity to sit down with the state and share their perspective in this reentry work. They're going to be doing this work in different cohorts over the course of the waiver. Grant County is planning to be and has signed up for cohort 1. Okanagan County was considering cohort 2 or 3, and the rumor I heard was Chelan County was considering cohort 3, but I need to follow up with them. So most of our jails are looking at how they can be actively involved in this work. If you go to the next slide. When you look at what active involvement looks like, you can see some of the requirements up here. And so there's some focus around pre-release services, specifically around case management, medications for alcohol and opioid use disorder, and for EDA supplied medications and medical supplies at release. So any jails that opt into this work, they're required to be able to deliver on those 3 bolded sections. They are able to opt into all 7, so including medications during the pre-release period, labs and radiology, services by community health workers with lived experience in physical and behavioral clinical consultations. So the other thing with that is jails that opt in to be part of these cohorts, individuals in jail can keep their Medicaid active or have their Medicaid activated 90 days pre-release. So the hope and the goal would be is that these services would be reimbursed through Medicaid instead of paid for it through the jail. So that's an incentive to keep in the continuity of care while people enter the jail system, and then help support reimbursement for this work. Most people in jail are in jail less than 90 days. So the assumption is most people will be able to continue on their Medicaid through the course of their incarceration. The other thing that's going to be part of this, as you see in bullet 2, is they're looking at, the state has a service called EHR as a service, and they're looking at adopting and rolling out an EHR platform for carceral facilities.
That's electronic health records.
Electronic health record. Thank you.
So the state's looking at a statewide EHR, they wouldn't have to like go out and find a vendor for one?
Correct. So they've looked at an instance of Epic to roll out across, they've had EHR as a service, and they've looked at Epic for other providers. But I don't know how far they've really gone along in that. Nikki, I don't know if you've been part of any of those discussions.
I'm not part of them, but I hear about them.
So for the reentry work, they're looking at developing an instance specific for carceral facilities. Now, there's a lot involved in that, and anyone who's rolled out an EHR knows that it's not as simple as just rolling out an electronic health record. So there's still a number of discussions around it. Their original target date was spring of 2025, but they're not 100% sure if they'll hit that date. I saw a note. Molly put a note that said, I've spoken to Colville Tribal Jail staff in the past about providing the community health worker service. I seem to do that work anyways, and they are released, and I assist in retrieving their Medicaid and SSI monies. So this is to you, Kyle.
Yeah, I see.
Yeah.
Perfect. Anything else you want to expand on that comment, Molly?
I pretty much did say there, I have a lot of released inmates that I have to quickly set them up with their Medicaid so that they can get their prescriptions and get seen again. And they lose so much. They lose their housing, they lose their SSI or SSDI, they lose their Medicaid or Medicare. So I help assist in getting that back for them. If we could do it beforehand, it would help them, because I had some homeless situations because they were released to the streets. Any assistance would be great to get them.
Well, I was just gonna say, for Medicaid, each MCO has jail liaisons or case managers even, so if their Medicaid should be reinstated quickly. It doesn't always happen that way, but if there is help needed, each MCO for Medicaid has specific people to help with that. Just
Yeah, tribal members do not participate in the managed care organizations typically if they are IHS eligible.
we do have quite a few tribal members as well. So I don't know if in that particular jail there aren't any, but
Molly, we would have to follow up I don't remember off the top of my head all the details or where they're at in conversations with tribal jails. I know they were on the list as part of participation, but I have not heard a whole lot of details around how they've engaged them. Also, just as an FYI, these services and reimbursement for this is only available to jails that have opted into a cohort.
I just want to see it go forward as a process. It does, I mean, I am being tapped up to do that work now. So
Yeah,
anything positive.
so you're encouraging us to get them connected with the Colville jail.
Yeah, I mean, it takes time. So the sooner the better to get that as introductions and discussions started.
Peter,
So John, just a question or clarification. So if the state has a statewide EHR, say Epic, I'm presuming that the people treating patients in jail come from other healthcare organizations, right?
I think that's yet to be fully determined or figured out. So a lot of jails actually employ at least nurses, MAs, and other medical staff. They might have a provider on contract, and Okanagan County has a provider that comes in 3 days a week, and they share that they're still on paper charts. So I think there could be instances where the jail contracts and or employs with medical providers. We had a conversation when we were in Okanagan County with family health centers. What would it look like if a medical provider came in and provided those services? And if that medical provider was able to just document directly into their EHR instead of going through Epic, and it sounded like that could be an option.
Okay, I was just wondering how if people come and go from jail and their normal provider is, in a clinic, how that integration works. But anyway, that you helped clarify that. Thanks.
I don't know, I'd say it's perfect or that it's going to be fully worked out at the start. I think that will have to be smoothed out.
I think one of the problems for providers like family health centers is that they have to provide care in approved locations, and through HRSA and everything else, having the jail as a location is probably would be difficult. So it may be that they have to contract with the jail and do it through their own EHR or something. Anyway, complicated.
All right, next slide.
Who's the person at HCA who is facilitating this process?
So it's actually it's a combination of their Medicaid division and their policy shop. And so from the policy shop, it's Emma Oppenheim is the primary point of person. I think they're planning on also hiring a jail transition manager specifically out of the policy shop, and then it's Tyron Nixon out of the Medicaid division. Just quickly a call out where we see our role in this work really is two specific ways: support the jails in planning, identifying supports for capacity building, and connecting them with community partners. That role is a little bit more fluid and can be defined more specifically by an accountable community of health. With our engagement already with Advance, with the reentry work, we're probably one of the more heavily handed accountable communities of health in this work, just because we've invested so much in the work that we've done into these connections and this transition work. And we also want to make sure it works well for our region. And then the next is really that connection back into the community with community-based care coordination and community-based workers. And so the work that we're doing under waiver with community-based care coordination and community care hubs, we're gonna want to ensure that those transitions get established into that work so that people leaving incarceration can get connected with a community-based worker to help them navigate services. Our recovery coaches right now is a prime example of how we're doing that work with substance use disorder individuals.
So, I'm going too much into the weeds, but how are they going to address the issue with undocumented human beings? Because they don't qualify for Medicaid.
You know, for the, I'll say for the waiver work, we get paid per member per month. Right, so we do have to identify how we're engaging the Medicaid population, provided that's up to the healthcare authority on that. They've loosely said, that, you know, we can use that funding to serve basically the population, what population we want to serve, as long as we're hitting our Medicaid targets in a way, right? Like, as long as we're demonstrating we are serving the Medicaid population to an appropriate level. If there is capacity to serve other individuals, we really believe in a no wrong door approach, and so we would do that. So that would include individuals that are undocumented. Right now, the recovery coaches don't check insurance status. So, but we're not, in the work we're doing under the recovery coaches, we're not required to, at this current point, to demonstrate any metrics up to a funder.
That's good.
Yes. I think I'm going a little bit long, so. Next slide. Right, or am I on time?
You're behind by 7 minutes. If we're sticking to it.
That's why I said I think I'm going a little long. If you go to the next slide. We'll probably send out more of a care coordination update for you all. And what I'm gonna email in that update is also June 28th, we had to submit a readiness assessment to the healthcare authority to demonstrate that our region was ready for this community care hub work under the waiver. We passed that. It's about 16 to 17 page document. So I actually encourage you, I meant to send it when we passed, and I apologize I didn't. I encourage you all to read it, because I know it sounds long, 16 or 17 pages, but it's actually pretty concise for the amount of work and effort we're putting into this, and it will give you guys a good perspective of what we're diving into to do this work. So we'll send that out. We'll send out a few other updates. We kind of gave some of those contractual updates as well. We've been really working with the other ACHs and Uncommon Solutions, which is a statewide contractor, and going through an assessment to identify what are the steps to build a mature care hub in our region. And so we've actually just finished that assessment. We've developed an action plan out of it. And so we're going to be developing a number of different steps and processes and timelines based on that to progress our region along in this work in alignment with the other 9 ACHs. So I think that's also to emphasize, there's a lot of work going at the state level and at the local level to engage into these conversations to figure out how we're really building up this care coordination network. And then if you go to the next slide. Then September 9th, forward retreat, in the ESD building in Wenatchee, October 31st. Veronica is also going to share some details, but just a reminder of our network summit at Campbell's Resort. And then, what?
October 23rd, you said the 31st.
23rd, wow, I am not doing good with numbers today, individuals. I told Rosalinda I was tired today, and that just signed. Finally, 2 things just to call out. Nikki Lewis, sorry, she's already spoke, and she is from WellPoint, and she is on the agenda for to be a potential board member. And then this is actually going to be Kara's last board meeting, I believe, because she'll be done at the end of the month. So I just want to give a shout out to Kara and the work she's done these last 3 months to support the rollout of our Wellbeing survey. She's probably seen as much, if not more, of the region than half our team after being actively involved in this work. So thank you for your time here, and that's it. Any questions? I'm done talking.
Okay, now audit.
And I see Tom Dingus from DZA on, so Tom, can we just turn it over to you?
All right, thanks, John. I'm Tom Dingus. I'm from DZA, like John said, we're the CPA firm that in our second year performing the audit for your organization. Presented a week to the finance committee. So also giving the audit presentation today to the full board. And so please ask questions as I go along. Can I share screen? It might be easier if I share screen, if you're fine with that. Yeah, work out that. And so couple reports we'll go through, and so please ask questions as I go along. I guess, of course, quick introduction. DZA, we're a CPA firm in Spokane, Washington, Spokane Valley. We work exclusively with healthcare organizations, not-for-profit organizations, things healthcare adjacent. Everything we do is not-for-profit or government related. 7 partner, about 60 people in our firm, and work regionally and really throughout the Western United States and even further in those industries. So moving on. So what I have up here is the audited financial statements on the screen. And just to hit a couple high points along the way. The first is obviously, I think, the auditor's report, where we as your auditors give our opinion on the financial statements. And it's an unmodified opinion, which means that the financial statements that follow present fairly the results of operations and the financial positions of your organization. What you would hope it says and what you want it to say and what it does say. Just a couple things to point out. The audit this year, it's a single year presentation most of the time, and in subsequent years, you're going to see audit presentations that are comparative of the current audit period and the prior. This was only the second year you had were really separate as an organization. And so this is the first year you're on the accrual basis, or really kind of fully in accordance with generally accepted accounting principles and how your financial statements are presented. Last year's audit was on a cash basis, and so not really comparative. And so that's the change there. Doesn't have too much impact, but good to know. Going to the couple pages in is the statement of financial position, or otherwise known as the balance sheet. And I think the main takeaways of this is the first 2 lines on your balance sheet is your cash and cash equivalents and your investments are $20,250,000, which represents about 2.5 to 3 years of your expenditures. So a very strong reserve, as was expected as kind of the life cycle of your organization as a community of health, accountable community of health, with some of the front loading of the money, your funding to get through the kind of the transition from the first part of the Medicaid transformation project to the second phase. And so very strong balance sheet, no debt, no leases. And then the second statement is the statement of activities and changes in net assets, or your income statement. You see that first line is your DSRIP payments under the first stage of the Medicaid transformation project. And that there's further information on that on note 2 on page 9, but it represents some pay for performance incentives related to 2021. The way the revenue recognition works is that it's not recognized, and revenue is not recognized till all the conditions to earn it are met. And you really don't know you've met those conditions until you get the reports from HCA that you've met it. And so it's kind of like cash basis, which has been how most of the other communities of health or accountable communities of health have done it as well so far. And then you do have a little bit under the 2.0 version. The new version started on July 1st, 2023. So $277,000 of that revenue under the new program, or the new version of the program. And your grants and contracts revenue, most of that is the HCA chart grant or program, Community Health Access Rural Transformation, is related to that. Investment return, good number in 2023. Large investment balance in 2023 being a good year for investments in general. So that contributed to your revenue sources. And then your expenses. And the change in net assets is a negative number, as expected in this transitional year between the old version and the new version of the Medicaid transformation project. I'm going to see how many times I can say that and stumble through saying it all. I'm just cheat with the acronym and say MTP or something. And so that was expected, and with your reserves, you can as I mentioned earlier, with the amount of cash, you have about 2.5 to 3 years worth of cash if you kept on spending money at exactly the same rate. The professional service number fee stands out a bit. That's some strategic planning fees that were paid, and then a lot related to the telehealth program, telehealth community initiative subcontractor that you have flowing through that amount as well. And then it moves on to the statement of cash flows, which tells kind of the similar story as the statement of activities. And then you get to the notes to the financial statements, which serve three primary purposes: who you are as an organization. The first note there at the top lists how you're formed, your mission, where you're located at, and how you're governed, who you serve, the who. The second purpose goes into the summary of significant accounting policies, which goes on for a few pages, which is the how different balances and transactions are recognized in the financial statements. Good reading for how the financial statements work, particularly this first part on the revenue recognition, which I kind of touched on briefly, which is going to change, is going to change with the new version of the Medicaid transformation project. So that's going to kind of phase out, and with revenue recognition being a little different under the new contracts. And then the third purpose of the financial statement notes is really additional details or information on other account balances and transactions, and information that a user of the financial statements would want to know. And audited financial statements serve a purpose for management. They definitely serve a purpose for board and finance committees and your governance roles. They're ultimately designed for people and stakeholders outside of your organization who would want to have some reliance on the financial information, and their granting, contributing, and other support and vendors and the like. And so not a lot to point out in these notes, a little more specific information about the DSRIP income and what periods it was earned and how it was earned. A little bit about your liquidity and available financial assets, which I pointed out, once you throw in your accounts receivable, it's $20.7 million of resources for your available for operations. A little bit of information about your investments in treasury securities and your retirement plan. And then a note that points out that some of your distributions to partner organizations go to organizations where some of you as board members also serve in those organizations. So you point out that related party element to those payments. And then the last note or disclosure is the functional expenses, which helps show how much of your expenses go to your mission, with broken into the behavioral health, care coordination, and network support mission part of your expenses, and then what goes to management in general. And about 87% of your expenses went to the mission expenses, and the remaining 13% to overhead, that's a high number on the program. Most not-for-profits we work with, you're going to really see more in the 70 to 85%, really. Management in general, 15%, 20%, and 25 to 30% is not that unusual either, just because that's what it takes to run a well-run organization. So that's a pretty quick run through the audit, and kind of to go back to the takeaways on that unmodified report, which means that financial statements are fairly presented. What's important, I'll have a second letter to go over, but what's probably even the other important takeaway is the report that's not here is that another report that we would have if there were findings or material weaknesses or significant deficiencies to report in an audit, and there are no findings to report, so there is no report of findings. So in some respects, what's not here is almost one of the most important takeaways, is that there's no findings. And we do report material weaknesses and significant deficiencies in audits, so it's not a given that organizations have that result. I'll pause for a second, Amy, or minute, or whatever you would like, of any questions so far. I got a couple more minutes to go on the last report, but any questions so far? All right. The other report that I have up that's in your packets is a letter from your auditors or report from your auditors to the governing board and finance committee of things that you might want to know from your auditors. And so it covers kind of a hodgepodge of topics. One of the first ones, if there were accounting policy changes, we'd let you know that. There are no changes in accounting policies this year. It then moves into key estimates in financial statements. Most financial statements have quite a few estimates. Yours doesn't have anything, a lot of estimates, but it is an estimate when you're estimating some of the expenses of whether they're mission driven or program service expenses or whether they're management and general expenses. Some people do multiple roles, space is shared. And so there is some estimating that goes into that, nothing too significant. The next two I think are important takeaways of this letter is no significant difficulties in performing the audit, and it did really go very smooth. And I think I saw Sarah on in the meeting with her team of your outsourced accounting people. There's Sarah waving, and in your team internally, the audit truly went very smoothly, and not just smooth enough for us to say that, but I do think it kind of ranks up there on the high end of smoothness of that we in our experiences we have in audit. So that's a good feedback for your, for you to know from your team, your management and your accounting and finance team. And then the next one, the corrected and uncorrected misstatements. No material adjustments come from the audit process. A lot of audits have situations where the auditors are the ones detecting something that needs to be materially corrected in an audit. And so if that was the case, we'd let you know that. That is not the case, which is a good takeaway, which can be a good indicator that the financial statements you receive on a regular basis are correct. And so important, good results there. And then the last part of at least some interest, I think, or at least I'm going to talk about it because I think it's interesting, is the last part where this is the second, third, or fourth year now, time flies, of whereas auditors, we share with you what we think are the risks in the audit process, is that audits are risk-based in that we're going to spend more times on the things that if they did go wrong, that would matter the most. And so we look at more than these things, but we try to identify the more important things to look at and devote more resources and time to that. Every audit is going to have two kind of givens of where an auditor is going to look at. The first bullet, management override of controls, is in every single audit, is the best internal controls in the world, which you do have good internal controls, can always be overridden by certain people in the system. So there are audit procedures where we look at that. And then we always look at revenue recognition. So you're always going to have those two as areas we focus a lot of our audit time. There's a third one this year because of, it was the first year, it was accrual basis. So there was extra focus on that because we have to look at both the beginning and the end of the year, the statement of financial position, and just thinking through that will go away next year. Other risks you might see are if there's a new accounting policy or accounting standard change that's material, or if you have something significant or unusual. And certainly one of our bigger audit risks in 2024 will be understanding the revenue recognition for the new version of the Medicaid transformation project, of how that will flow through to accountable communities of health. So that's the, did I stop share? Yeah, I did stop share. That's the planned audit report. Any questions or comments or thoughts?
Yeah, you mentioned the level of smoothness. And my question to that is, to what do you attribute that ranking so high?
Why it went smoothly?
So you said high level of smoothness.
What did you say? What did you say? I didn't hear that.
You said that in comparison, there was a high level of smoothness. And my question is, to what do you attribute that in your experience?
Sarah and her team, that your outsourced accounting team, definitely were prepared for the audit and are experienced with working with auditors. That's part of why you hire them. And then certainly internal teams that support Sarah's work. It's not just all Sarah and her team, I'm sure. But and I think the right focus on the audit is that when it was time you were ready to audit, it was, the team was responsive and we got it done. Yeah. And so, yeah.
I give Sarah, Kristen, and Teresa a lot of props for, I know that between the three of them, they put in a lot of work making sure all the documentation was available for Tom's team. And I felt the same way as Tom. It just went so smooth and so quickly, and it was just, you know, to be able to go into a room with your colleagues and not feel like you have to sweat saying that you're going through an audit while other people are talking about all their audits, it just, it's a good feeling.
See, Peter has hand up, I think.
Yes.
Oh, this is just sort of a standard comment, but it's a reminder to the board that it's nice that staff and the auditors, get along and work well together. That makes things go smoothly, but it's a reminder that the auditors report to us, the board. We hire them directly, and we hire them, to look over management to make sure that, everything is copacetic and things are working, so that, we need to own this relationship. It's just a reminder that the auditors work for us, not for management directly. So there you go.
That's a good point. I used to, I sometimes I even take that further, is I've done presentations of what is an audit before to not board training. And like sometimes the question is, do you work for the management or you work for the board? And sort of there's elements of both. The board is responsible, like you just said. Ultimately, though, the audit, really our responsibility is to those stakeholders outside of the board and management. It's really to whoever's going to read it outside of the organization as well. So it even really goes beyond that, the responsibility of the audit. So, it's a good point, Peter, to point that out of everybody's kind of level of owning the audit. Yeah.
Thanks.
Yeah. Maybe I made up some of your time, John, on the agenda.
15 minutes.
I'm sorry, I talk too much. Tom is just much more concise than I am.
Yeah.
He is in accounting.
Yeah. Well, if I was talking a long time, that's probably not a good indicator, right? I'd be more to talk about. Yeah. And sometimes I do have to talk longer. Yeah.
Just as a note for everyone, just be aware, Tom also works with one or two other ACHs, so it's nice to have that, again, that expertise across the ACHs, since we've had some unique revenue recognition and contracting process to have his expertise kind of spread across.
Yeah.
And also with the DOH contract, and since it's splitting between a year, I don't think we'll get to a point that we'd be required to do a single audit next year. But at some point in time, we've been preparing with the assumption that we will end up doing a single audit in one of the upcoming years.
And if it was for 2024, the threshold would be $750,000 of federal awards. For 2025, it will be 1 million. So you might not have to do that for a while. Yeah. But
you need a motion?
Yes.
Yeah.
Move we accept the audit as presented.
I'll second it.
Right, it's been moved and seconded to approve the audit as presented. Any discussion? All those in favor say aye.
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 Opposed? All right, motion carried.
Perfect. Thank you all. Thank you, Tom, for joining the board again.
all right. Thank you, everyone. Bye-bye.
Thank you. Very good. So, quick but not so quick, Wellbeing survey update. So next slide. As of today, we actually have 2,047 surveys entered.
most of these slides came from Friday, so Kara has been busy entering some paper surveys, so we have passed the 2,000 survey mark. And our goal is to reach 2,500, which will be 1% of our population. And we're going to be really working hard on contacting all the partners out there who have been helping to distribute the survey to make sure we're getting those paper surveys back in and entered as quickly as possible. Especially since the survey end date has been extended now through the end of August, so August 31st, to make sure that we are capturing Grant County Fair. Thanks, Rosalinda. And we'll also be at the Douglas County Fair, and Kara will be there. Also, a lot of the back to school events, we're going to try and catch some of our residents there. So that's kind of where we are today. Next slide. We're going to go through quite a few graphs and things, but John really wanted me to just kind of share where we are in terms of where our region is as of right now. On the ladder, we have about 65% are saying that they are thriving, which might be a little surprising. We haven't looked, so I can't tell you much about this other than this is the actual distribution of people who say like, I'm a 0, a 1, 2, all the way up to 10. So we are seeing a large percentage right there at 7 and 8, which is thriving.
Can you explain the colors?
Yes. So yellow is where the cutoff is for suffering. The green is kind of struggling and blue is thriving. Is yellow and blue together green. So it's middle. Yep, next slide. So this is kind of the breakdown. So there's another question that asks specifically where you would put yourself on the ladder for your physical health, and then the mental health, and then financial health. So you do see that difference along the financial health, I think, which is maybe where like in your kind of normal day-to-day conversations that you might feel like there's less thriving. So here we see only 45% within that thriving designation. So maybe a little insight. This of course is like not any big analysis, just kind of the numbers put on paper. So
Can I just comment on that? Just so I asked Sarah to start pulling the numbers too. So this is directly out of SurveyMonkey, but we're also working in partnership with Public Health Seattle King County to do more of a analysis of the data. So just wanted to get this in front of the board so you guys had a sense of where this was going and some of the progress around it. But there will be more information and analysis and breakdown of the data after this.
Yeah. Okay, next slide. So then also we asked about where people felt their sense of belonging, where they felt they fit, and then also just the overall where they felt the rating of the well-being of their community. So a little insight there also that the community well-being isn't as high maybe as their individual sense of well-being. And that might have to do with their sense of belonging, as long as they feel like they belong within a certain population, that helps increase their overall sense of well-being.
Do we just segregate this by county? I took the survey, I just can't remember.
Yeah, so next slide, you'll see where we are with the counties. So I haven't disaggregated those first questions by county. SurveyMonkey for some reason doesn't like
those questions the way it's asked. So it won't do it for me. I'd have to go in and actually run the numbers specifically, but you can see where we are the survey wide. In terms of numbers, Okanagan has surged ahead, as you'll see. They have we're now over 16% in Okanagan, which is really great. And we'll continue to really focus some of our efforts in Okanagan because it still seems hard to really reach residents there. And we know that we'll be having the Douglas and Grant County fairs coming up. So we expect those numbers to go up again. Next slide.
Sarah, Peter has his hand up.
Okay, Peter.
I took it down. Sorry, it was an accident.
Oh, it's okay. No worries. So here you can see our age distribution. We have responses throughout. We're definitely not targeting under 18 with this survey. So it's not surprising that we're low on that percentage. I think otherwise we're kind of are where we expect to be for our age range. Although, you know, we're still looking for more 85 and plus. That'd be nice. Next slide. So where we are, we're actually at 40, almost 42% Hispanic Latino, which is a really great response. And so we're actually underreporting for a white Caucasian population. And so it'll be interesting to see where we end up here at the end of the survey.
Can I choose more than one?
Yes. Yeah. Next slide. Also, gender identity, the American Community Survey, which is our comparison, only collects female, male. And also again, here they can select more than one if they choose to. And yeah, we still have a very high female response rate compared to male. But I think part of that, as I said last time, is that if there's like a family that comes up during events, it's usually the mom or the wife who fills out the survey. So just one observation. Next slide. Kind of, again, sexual orientation is not collected by the American Community Survey, but this is kind of, I think, where we expect to be. If anything, we've got a greater response through different categories than we necessarily thought. We have more than 10 for each category, and so we're able to report that as a full picture for our region. Next slide. And then looking at level of education completed, again, we have a fairly good distribution throughout all categories. And I think, again, it doesn't fit exactly with the ACS, but pretty close, and you can take a look at that. Next slide. Again, we have quite a good distribution throughout in terms of the income range. If anything, we'd probably like to see a little bit more in the 100,000 and 200,000 plus range. So, next slide. Yeah, what we expect to see in terms of household. Next slide. There you go. Yep. And then dependents again. Wendy's flipping through it a little bit here. Keep
Sorry,
going.
my roller rolled it, so now I'm trying to figure out what slide we were on.
Oh, yep. Oh,
There.
well, there you go. That's it. Perfect. Yeah, just number of dependents, again, not covered in the ACS, which is our comparison. Next slide. So as John was saying, we will be working with Public Health CL King County to do the quantitative analysis of the survey. And so we're putting together our plan for them in terms of if there is any like rolling up of data or aggregation, disaggregation. Just working on the actual plan for that.
That will also help us like start like to your question of breakdown by county, potentially income, race, any kind of demographic. It'll
Those
give us a
cost
chance to
tabulations.
start looking at that in a little more detail.
And then we're still working out the plan for the qualitative analysis. If we'll need some help with that and going out into our community and having a more community driven discussion of that, of how to analyze the qualitative. So there's 2 open-ended questions on the survey of and then also looking at what's coming up with the community dialogues, how to kind of roll those in together. Our plan is to present all of this at the Wellbeing at the Thriving Together Network Summit on October 23rd. So it'll be a pretty quick progression from the end of the survey at the end of August to being able to present the data at the end of October. So that's kind of our next steps. Any questions? I'll take questions right now and then I have just one more slide.
So the qualitative,
Mhm.
you'll analyze the 2 open-ended questions on the survey.
Mhm.
Can you go back to the community discussions? And then you're gonna have a set of open-ended questions for going out in the community for which.
Yeah,
you'll
so
have
the
those 2
community
analyses.
dialogues, which Veronica will talk a little bit more about.
Oh, I'm jumping.
No, it's okay, it's okay. But the community dialogues really, the questions in that talk about well-being, and so we'll want to include whatever we find out in those initial community dialogues, kind of roll that into what we're taking away from the survey, open-ended questions.
I think 85 years plus are gonna need help.
Yeah.
So, I mean, I'm just saying, I think someone needs to go.
Yeah.
Yeah. Yeah, we are working with some of the senior centers to help provide some of that. So.
Okay.
Any other, yeah, I mean, I also would appreciate, yeah, any, in terms of, once you look at this kind of these graphs, if you have any suggestions of where we should
Specifically,
go.
if there's any places you think we should connect with too. We still have month of August to get out there. So if there's, especially when you see the population, so even 85 plus, if you think those organizations have a good connection with that, Sarah will make that connection and Sarah and Kara can work to get out and engage that population.
And then I was looking at the languages. So we have this survey available in 5 different languages. English, Spanish, Russian, Ukrainian, and Vietnamese. And really, it's only been filled out in the English and Spanish. I have Moses Lake Community Health Centers is working on trying to get some of the Russian, Ukrainian population to any of their patients to fill it out. And also making connections with maybe some of the churches, especially in Grant County. But it's, again, not been the easiest, but we've definitely been putting our network and our partners to work, so.
What do you attribute the 43% Hispanic population, I mean, that's, I've never seen a number like that in a survey.
Honestly, we have really great partners, CBCH, Community Health, Chelan Douglas Health District, has been a huge partner, Una Cafe, they've all been working tremendously hard in getting this survey out. And, Kara has also, she's been to some of the aid camps. And so it's our partners and Kara.
I think some of it's just been the partners we've actively engaged with have served more of the Hispanic population, even the LGBTQIA plus population. I know they're small numbers, but there's still, I was impressed to see that, 1 in 4 of the individuals who took a survey weren't heterosexual. And so just, again, with some of those partnerships, we're getting some level of representation of communities that typically aren't represented.
Peter?
He's had his hand up for a while.
So Sarah, one of the biggest disparities I noticed was the male-female distribution. There were more than 2/3 of respondents, like almost 70% were female and way down there. And I guess it's understandable because a lot of our partners are in social service networks, which are, primarily female-based. A lot of the employees are. But how can we overcome this? It feels like it's, there's a gap there.
Yeah. Ray?
I don't know, Peter, if we should overcome that. And this is why, like, it is traditional even across the world that if you want to know the health and wellness of the community, you ask the females who are running the family, I want to say like managing the children. And they showed this in Pakistan, they showed this across in other countries. Like, if you want to get your real pulse on what's really going on, you ask the females and they will know more than the males do. And so I'm comfortable with that data, but you may disagree.
Yeah, I don't think we want to have a debate, but I think there's a lot of literature out there about men are not doing well. Traditionally men have been, the power authority people and so forth and so on. But there's a lot written about that, and it would concern me to miss important voices out there, particularly among young and middle-aged men.
Well, it'll be interesting when we dissect the data to see what because we didn't see the breakdown of male, female in the responses. We had the response rate, but not necessarily in the responses.
I would be curious, now if you made a question, how am I trying to phrase this? Like, I wonder if the people who've been administering and asking the survey have been predominantly female, and if you were able to get more males to also be the ones who are asking and administering the survey, if you would be able to engage. Like, I'm just thinking engage more males in taking the survey. Like, I'm going actually under assumption, Peter, to your point, since social service fields are predominantly female, that the likelihood to people who are also promoting the survey were predominantly female.
Yeah.
And I don't know if that makes an impact or not, depending on what circle you go to.
It's definitely, we're definitely aware of it, Peter. I don't know if we kind of figured out how, I've tried going in car shows versus,
Just guys don't want to do stuff like
yes,
this.
they just don't want to do it.
That's part of the reason right
Here
there.
to see the cars.
Yeah, right?
Yeah.
So, we'll keep trying though.
Sarah, this is Wendy. I'm curious, have you looked at the breakdown in each county to make sure that we're not centric in the main cities like Wenatchee, Moses Lake, and Omak, and ensuring that we're getting representation from the smaller towns as well?
Yes. I don't have that on these slides, but I do, Kara and I check in all the time and I'm sending her to the smaller towns and cities. And making sure that we're trying really hard to get that response of at least 10 so that it can be reported out for each of the smaller areas.
What were some of the things? And if I missed this in update, I apologize. Like events that you've hit, like in, like Chelan just had the rodeo. Douglas County will have multiple where people are coming in from our rural areas during fair time, same with Grant County. What were some of the things that you guys have hit?
We are gonna be at most of the fairs.
Back to school,
Yeah,
we're just at Quincy, or we're going to Quincy.
we're going to Quincy this
Bridgeport.
week, back to
You're at
school,
Royal City.
Royal City Summerfest.
We hit a lot of the different Pride events.
Yep. Manhattan Pride, Chelan Pride. We have partners at Wenatchee.
Yeah, and then a lot of it has been just using our partners, and so I can't tell you exactly where everyone's been. I did see Donnie Guerrero from Molina was at the OMAC Family Health Center's health fair, and I could see the survey right there on this table, and so I know that it is getting out there in different aspects. We tried really hard to try and find someone who will be at OMAC Stampede. We haven't quite figured that out yet, but we still have a little bit of time.
Well, thanks. Yeah.
But we will hopefully be working with family health centers to be at all of the back to school events.
And this is good feedback, because, the plan would be to continue to do this. This isn't a one and done process, so at some point we're gonna wanna come back and evaluate. And so, learning where we could hit or target more, make adjustments to our outreach, any of that's gonna be important as we iterate this process over the years. So, even if individuals are at an event that they feel like we would have benefited of being at, let us know. If there's just other connection points too, we've done some, not necessarily through events, but other additional connection points to get information and get people connected to potentially doing the survey. Any feedback board members have is invaluable, so I appreciate that.
Okay, and then just my last slide, Wendy, if you don't mind.
It was just the thank you slide.
Yep. So, John's already said it a lot, but as someone who was on maternity leave throughout almost half of this process, and also came down with COVID and all of those things, I really just have to thank all of the staff here at Thriving Together, our partners, for just being tremendous support for this process. Being my voice and feet on and hands at work throughout this. So I just really, really want to say thank you, not only to the staff here, but also to all of our partners who have done a tremendous job in getting the survey out there. Thank you. And I don't know what I'm going to do without Kara here at the end of the month. She's been so great to work with. We wish her the best of luck at Brown. And
Wow, you're going Brown?
Yeah, she goes to Brown. And we can't wait for her to come back and join our public health ranks here in North Central Washington. So thank you.
It's been great.
All right, Veronica.
I'm next. Wendy has my slide deck, so I'll wait for her to load it.
I told you I was going to take all the time though.
You did, now we're 3 minutes behind.
Yep.
I'll try to keep it under 5 minutes since that's my allotted time now.
You
All
have time, Veronica.
Okay.
We do not need 1 hour for the annual report.
Thank you.
Or we'll come after me.
Sounds good.
It's a narrative.
It's gonna be a read aloud. As
Yeah.
patient.
We're not the type that we're good.
All right, so I will be covering the Vital Conditions Network update as well as the summit update that we have coming up this fall. So if you just want to go to next slide, Wendy. So just a reminder, the Vital Conditions Network is made up of regional partners and organizations throughout the North Central region. We have a measurable goal of all people and places thriving with no exceptions, similar to our organization's vision. And if I had to emphasize and highlight, I guess, the work that we're currently doing as a network, it's slowly growing. We have, as of last Friday, 21 individuals actually sign on and go through the process of getting them onboarded. But basically, I would say that we're slowly but surely working towards these items that I've have starred on this slide. And I think it's pretty safe to say that the first few months, maybe perhaps year of developing this network, I think it's safe to say that this will be kind of the main focus, convening partners, connecting them across the region, supporting communications, and building capacity through workshops, trainings, and identifying kind of what we want this to look like. I think once the network is more grown and it becomes kind of like that well-oiled machine, I think it's just safe to assume that we will start seeing more of that collaboration, planning, and more action taking place. Obviously, we're already doing a lot of the measuring or the shared measurement efforts with Sarah and her measurement of well-being. And then we recently started dabbling into the legislative or advocacy work through our consultants and the new legislative committee that we have formed. Next slide. So just a reminder, I wanted to call out the Stewardship Council, who was formerly known as, I think, a variation of two strategy work groups. This was before my time, but they basically came together and recognized that partners, networks, and organizations, we can't do this work alone, and we truly are interconnected. And so I really like this visual that Morgan had prepped for me when we were launching the webpage for the network, just because it really puts into perspective what the regional vision of this network. And just, by relying on one another and coming together, we can start to invest in these upstream solutions and just slowly move out of that reactive way of, I guess, doing business across the region and across sectors. So next slide, Wendy. So I want to wrap up the regional network piece update by just giving you all a quick overview of what the onboarding process looks like. And I want to give a quick shout out to Ray. You're the only one from our board members that have actually gone through the process and officially signed on to the network. But I do hold weekly orientations for those partners that have officially signed on. And I break down our onboarding process in 3 parts. I do a quick introduction and provide some background of the organization and the ACH structure. And then part 2 basically includes the regional vision. And then I break down kind of the vital conditions framework, what that means. And I also do a quick little deep dive into the belonging and civic muscle one, since that is the most important vital condition. And then I wrap things up by going over the partner benefits and resources that we have to offer. I save the best for last, so I make people wait. I make new members wait to learn more about the partner benefits and resources. And basically, this is where I call out any ongoing training opportunities or workshops that we have going on. So for example, we just did our dialogue host training for the Wellbeing dialogues. We had that training Friday, July 26th. And the training was actually, it was built on the work of the work group, two different work groups or two meetings that we had. We had a Wellbeing Dialogue work group, and they helped kind of design what we wanted this training to look like. We created the guidebook that they were able to take home with them, and really dive into and identify the questions that we want to really pull out that qualitative piece of this well-being measurement that we're trying to research. So I'm excited to see where these new, where the trainees, where they take it from here. There's already a few of them that have reached out and are excited to start doing their own community dialogues and within their own networks. So come October 23rd, we'll have some more updates on what the well-being dialogue efforts look like across the region. And speaking of summit, so if we want to go to the next slide, Wendy. So we sent out our save the date for the October 23rd summit, which will be in Chelan. You can go to next slide, actually. And so the purpose of the summit is truly to establish and launch, I guess, the Vital Conditions Network, to connect partners, learn with one another, and just discover those opportunities where we can share action. Our summit theme will emphasize belonging and civic muscle. And we just want to ensure that we provide an update also on our well-being measurement efforts. So like I said, including not only the survey, but also the dialogue work that's hopefully happening from now until then. So there's still more planning to do around the breakout pieces, but I'm excited to continue to plan for this event. And this is just a quick overview of what we're planning for that day to look like. So we're still looking at speakers and, like I said, engaging partners in those breakout sessions. So more to come on that. Next slide. And then just a quick reminder that if you haven't officially joined the network, I encourage you to do so. And then once you go through the full step process, I encourage you to provide any feedback so that I can continue to improve the onboarding experience and process for future network members. Next slide, I think that's it. So unless there's any questions for me, that's the end of my update.
I think the only other thing I would comment or put out there too is, as we've been looking at growing the Vital Conditions Network and doing these dialogues and around well-being and surveying around well-being, we've also been engaging and having more and more conversations with the regional coalitions for health improvement. So we're trying to figure out how we've grown and built this network, how it intersects with the work of the CHIs, and how we can better really align those things together. And so we're actually going to be engaging and having more conversations with the different coalitions for health improvement to really see how we can better work both the network and the CHI work more closely in alignment. They both really are, and all of us are really leaning into really that upstream well-being work. And just recognizing that they've been on both the CHIs and the network have been on the same, like slightly different journey. How can we better align this work together? And so just wanted to give you guys all a heads up as we engage in those conversations. You may hear more updates coming back, or don't be surprised as we talk about how we're trying to really pull the coalitions into this more closely.
Thank you. Oh, Peter, you have a question.
So Veronica, as the network grows, do you see members of the Vital Communities Network identifying with one another? In other words, do you see a lot of sharing and discussion among members that they identify together as a community?
Yeah, I think so. I think that is in one way a goal of the network to, really identify with one another the work that we're doing. And because I think I was talking just earlier with Kyle about the Vital Conditions Network and how it's really easy to tie a lot of the different work that we're doing across the region and across sectors to the vital conditions. And I think that is the beauty of that framework. And so I'm excited to see what this network looks like once it's up and running, you know, how the cadence of our learning sessions for each of the vital conditions. And I think that's where we'll really get to see the partners working within those sectors and within their own networks really come together to really understand what it means to do upstream work within each of those vital conditions. So, and it's slow work, but I'm excited to see where it goes from here. I'm not sure if I answered your question, Peter, but
No, I think you did. I was just thinking of, you know, my community and the number of organizations that are involved in social services work. And that, you know, this is an opportunity to, you know, tie them together through this, you know, vital conditions network, you know, to create some cohesiveness among them. I don't know, Ray, do you have any comments? You're a member, right?
Yeah, I mean, I feel like we've been kind of doing that in the Chelan Valley already. But that's the whole goal is like we get everyone together and like, oh, I didn't know you're doing something in my valley or, you know, in my area that we can collaborate with and then create those relationships and connect those resources and then collaborate effectively to do care coordination. It's basically what I hope. I mean, unless you guys, and I'm really simplifying it, but I mean, unless you guys feel like I'm off base.
I mean, it's one thing I'm really excited about the summit coming up in October is that it's not just us talking at our partners, but it's really a time for our partners to come together and collaborate. So.
thank you, Peter. Any other questions? All right, I'll turn it back to you, Linda.
All right. Thank you, Veronica. And wow.
All right, as you know, part of the role of the governance committee is to vet and meet with potential board members. So we had the privilege of meeting with Nikki Lewis. You see her presentation packet or page in your packet. She is coming to fill the health plan seat on our board, and I, without hesitation, present her for nomination and acceptance to the Thrive board. So somebody wants to make a motion? I guess I can.
All right. I'll make a motion.
I'll second.
All right. It's been moved and seconded to welcome Nikki to our Thriving Together. Thank you so much. First, I must say, all those in favor say aye. Aye. Opposed? All right.
I appreciate you making the trip.
Yes.
One of the things we
Thank
talked
you.
about.
Thank you
And for those of you who
being
were
here.
involved, what caught me most was her collection of guitars.
Oh, really?
So she's a musician. She and her partner are both, right?
Yes, yeah.
In what area do you reside?
So I live in Seattle,
More specific?
Lake City, North Seattle. Yeah.
And I appreciate because Nikki might be the second or third person to go through the interview process with the governance committee, but again, it is really nice to have the opportunity to meet potential board members beforehand, ask questions, get into more conversations about the interests of joining the board. And I appreciate the governance committee being willing to do that too.
Yeah, thanks for that extra work, governance committee.
we're gonna have to reject somebody just so you guys know that we really are working on it.
Send you a couple of candidates.
I would say we do quality recruiting.
Yeah.
High
There
quality
you go.
recruiting.
All right. That's what we'll say.
Okay, so. Are you ready, Morgan? Three acts.
Yes.
Question, we had another candidate, so what happened? He did
They
reject it.
withdrew their application.
Oh,
Yeah.
okay.
Yeah.
She had a change in work schedule and she didn't feel at this current point in time, she could commit to the
Yeah.
capacity, so. I think she's still a great candidate, and if anything changes back, I would encourage us to
Yeah.
engage in conversation with her.
All right, so I will jump in and chat a little bit about the annual report. So we sent this out in our newsletter, I think. We did a special campaign for it. It also lives on our website, so if you hover over the resources and news section and then go to data and reports, you scroll down, we have a report library, so you can see and download it that way. We are also working on getting the physical copies mailed out this week. So 2023, 2024 board members will see those coming. And then we're also sending them out to partners that were featured in the report. And then we have extra copies for anybody who would like one here at the office. So as I said, won't read every single page, but just kind of give a general overview. Last year was the first year that we did a published annual report, and I believe it was 16 pages long. So you'll see that this year it is 24 pages. So I think a lot of that is partially due to the fact that over the last couple of years, we've increased our staff. So we have new staff members that are filling positions that we previously didn't have at Thriving Together in CW. So it's exciting to see a lot of that extra capacity translated into projects that have that we're able to share with our partners over the last year. So I will go into the first couple pages are really just mission statement, a little bit about us, our framework being the vital conditions and service area. And then we have a letter from John here. So he just kind of goes into some of the main themes from our work over the last year, touching on our brand transition from North Central Accountable Community of Health to Thriving Together NCW. And then really highlighting major theme from the work over the last year is working on building our network and strengthening those relationships, but then also working to increase our partners' capacity to be able to fulfill their mission better, so that we can continue to really uplift our partners in the work that they're doing. This was exciting. A lot of the work that was done kind of around Veronica's position and the Vital Conditions Network we were able to share with our partners. So we kind of wanted to do a little bit of a mix of calling out the different committee members. So here we have the Stewardship Council. You can see their organizational affiliation and then the partnerships that they represent. And then we go a little bit into the partner agreement and then calling out building internal capacity with Veronica's position. And then on the digital version of the report, you can click, there's different links. So you can click to see, like this, for example, will take you to the actual partner agreement. And then we did want to call out belonging and civic muscle as, you know, kind of the heart of the vital conditions. So on this page, we talk a little bit about how we engage in equity. So we wanted to highlight our partnership with the NCW Equity Alliance and kind of call out all of the great learning sessions that we were able to kind of help them bring to fruition within our network over the last year. And then a big pool of money that was awarded last year and the year before was through community-based equity initiatives. So you can see our different partners who received funding through that. And then in the appendix at the very end, you can read a little bit more about what those projects actually entail. And capacity building was another big one that we wanted to call out. So you can see at a glance all of the different workshops that we offered, and then we also kind of wanted to highlight some numerical call outs with the total number of hours that were offered and total number of participants. And then over the last couple years, we've also been working with the Nonprofit Practices Institute to really kind of grow our relationship with them and being able to bring more capacity building opportunities to our network and kind of combining resources to be able to do that. Data initiatives is another exciting call out. A lot of the work that Sarah's been doing with the Shared Measurement Task Force. So we wanted to highlight the shared measurement data inventory that is up on our site. And then also the development of the IP3 reports. So those are on our site as well, and they're linked here at the bottom of the report. And the IP3 reports are the reports that go into each of the vital conditions and how our region kind of stacks up. We've got some information on systems improvement. This was a cool project that was started in 2022 with a work group that we had, and in 2023, basically the recommendation from that work group was to launch a behavioral health triage pilot in the emergency department at North Valley Hospital. So you can kind of read a little bit more into what led into that project, and then milestones and next steps. Recovery initiatives and harm reduction. This was exciting because a lot of the work that is done in this space is really tangible. Like we can see those numbers here at the bottom. 672 recoveries served by coaches last year. 27 additional recovery coaches were trained, and then 60 hours of capacity building offered to coaches. And on the next page, we have a call out to our partnership with Carillon with putting Narcan vending machines throughout the region. There's the map that you can see where you can go ahead and get free Narcan, and then also some other great stats about 60+ overdose reversals and lives saved, and then over 1,500 boxes of Narcan distributed. Community-based care coordination is something that is kind of more of that like slower systems change work. So for this, we really wanted to highlight all of the partnerships that we really worked to strengthen last year. So there's information on some of the technology infrastructure that we implemented with Action Health Partners and Advance, the resource directory infrastructure group, work group we wanted to call out. And then cross-sector collaborations was another pool of funding that we awarded to our partners last year. So you can see again in the appendix, we have the recipients highlighted here, and then you can read more about their projects in the appendix, excuse me. Digital equity was something that we did a lot of work around last year. So again, you can kind of see milestones. We have telehealth advancements there at the top. We also hosted a virtual care conference last year, so you can see some highlights from that event. And then another big partnership that we wanted to call out is our work with the NCW Tech Alliance. So you can kind of see all of the different projects that we were able to partner with them last year, and then the impact that that's had across our communities in the region with some numerical call outs. Workforce initiatives, this is talking a little bit about the behavioral health internship program that was started in 2022, and then just kind of expanding on where that went in 2023. And then I'm going to hand this one over to John. We just in the 2022 annual report, we didn't include any information as far as financials, and we decided to include a little bit of that this year. So John, if you wanted to.
Yeah, and so we debated a little bit, we looked at a few annual reports on what kind of financials to include. Normally in some you'll see more details because typically the report is geared towards funders, especially if they do fundraising or philanthropy locally. A lot of our funds are really driven by state contracts, and not that we don't want to give the report to the state contractor or organizations, but this is really for the community, so we just wanted to highlight really our mission and commitment to continue to invest into the community, and that's what we're showing here is our typical community investments as a whole, and our commitment to continue that moving forward. So Sarah worked on some projections based on looking at funds flow over the course of the next few years based on revenue and expenditures. And so that's where you see the chart at the bottom. I think really, I mean, it also speaks to, and the report as a whole speaks to really the way that we do our work is in partnership with community organizations. And so really a lot of our funding is going to go out to community organizations. Another aspect that we continue to see grow or need in is supporting building capacity into smaller organizations, especially small grassroots organizations. And so you've seen a lot of reference around capacity building. Sometimes that will look like funding to support organizations to build capacity. Sometimes that's really turning into like, how are we either partnering with organizations, trainers, or things to bring resources and services to the community. So sometimes we'll act as the agency that holds the contract to provide capacity building supports to our community partners. And we'll manage that so that they can focus on building that capacity on not managing a contract. And so we've also seen ourselves lean into a space where we're just supporting community organizations and how they can build that capacity, how they can grow, and how they can function better as an organization.
Thank you, John. I think the rest is just, yep, appendix. So again, just a really brief kind of high level overview that lives on our website. And like I said, we've got copies here that we'll be mailing out this week, and we encourage you all to take a look if you haven't already.
Yes. Very nice.
Yeah, I want to congratulate Morgan because she gets the pleasure of meeting with everyone and working on building this report together. And our work is, you know, since we aren't a direct service provider, sometimes it's hard to figure out what exactly to put into a report, and she's done a phenomenal job with it.
Ray, did you have a question or a comment?
And as the comment, thank you so much for doing this. You know, annual reports are also historical and like gives you good perspective, like where we're at and where we're going. And then where were we at 2 years ago? And those things are really important, and there are a lot of work to put that together. So I appreciate that.
That's right.
I'd also comment too, like, I've actually found these personally useful when I'm engaging with partners. A lot of this, to your point, Ray, we're continuing to build upon this work. And so this really does give a good summary of what our organization is doing in the community. And so sometimes it's a very nice, actually for me, tool to say, hey, you know, I'm going to talk about our work, but I also encourage you to read our annual report because it gives you like a few tangible things that also you can relate to that better understand our org.
Thank you very much. Any other comments for the good of the order?
I see Dell's on now. He missed all the good words.
I know.
I'm sorry, guys.
All right.
Where's your
Del?
where's your cape, Del? Where's your cape, Del? You're missing your cape.
I know, right? I appreciate you guys. Thank you.
We did recognize you, Del, for your award at the CPTS Summit.
I appreciate that. Thank you all very much.
Well, without any further ado, adjourn the meeting. I don't think I need a motion for that.
No, you don't.
Thank you.
Thank
I'll
you.
let someone besides not to adjourn.
Thanks for the snacks.
If anyone wants any